So the debate is whether you give anti-VEGF injection in a center involving DME with good visual acuity. Yeah, a patient comes to you with a edema like this, but having 6/6 vision, what do? Options are intravitreal anti-VEGF, even here that comes first, focal or grid laser promptly. Note here, visual acuity worsens, begin anti-VEGF. Observation, if DME worsens, begin anti-VEGF. So just note these points. There's enough evidence to show that anti-VEGF agents are good for center involving diabetic macular edema. There are enough studies, I won't go into those details, to show that these drugs are effective in diabetic macular edema. The protocol I has also clearly shown that ranibizumab or Lucentis with deferred or prompt laser for macular edema is definitely better compared to a prompt focal or grid laser. However, these tests have been whatever the cases that were included were cases which had 20/30 or worse visual acuity, not those with good visual acuity. So what happens if we do not treat or observe only? It's been shown in few of the studies that if not treated, many of these cases could have structural damage to the retina. Lasers, you could try, but again, as we all know, it's a destructive procedure and you do have the effects of destruction in these cases. My colleague, unfortunately, is not here, Dr. Dogra sir, in his study has shown that there is a delayed closure of microorganisms with laser therapy, so you would not advise laser therapy. So if you look at, there are no data available as such for this. So there is, in eyes with center involving diabetic macular edema, if you look at the ETDRS data, which has shown that the focal laser, those cases which had good vision were treated, and when they were followed up over a period of time, who had lost 5 lines or more, those who were treated with focal laser at about 27%, and in the observation group it was 40%, so it showed that definitely observation is going to worsen the situation. So if you look at the 2-year data and compare it with protocol I, for all these groups, 27% in the focal group, 40% loss in the ETDRS observation group, while only 4% in the protocol I group where the injection was given. So obviously there is a definite value in giving injections into these cases. As I said, there's enough evidence to push the scale towards this. If you have a fire, do you let it go like this, or would you bring in a huge fire engine to break this, or just simply throw a fire? So the recent protocol V, which is expected anytime, later in the August this year, will give an answer which is exactly looking at this point of whether we are going to treat or not treat in cases with good visual acuity. Thank you for your...
Thank you, Kim sir. So his verdict is that you should not let even a single diabetic person escape